Welcome to your new OB visit here at Partners in Women's Health. We work together as a team of providers to give you the best quality of care. During your visits, you'll get a chance to meet everyone that will be taking care of you in the office, as well as delivering your baby at the hospital. Typically, we will see you about every 4 weeks for visits and pregnancy, but if things come up, we will add additional visits as needed. We also have nurses and assistants. They answer our phones 24/7, so please don't hesitate to give us a call, even at 2 in the morning. We also work with another group of private female doctors who cover occasionally on weekends, but definitely we strive to do everything we humanly can to be the ones to deliver your baby. Today, part of our visit is to cover basic questions that often come up, such as diet, exercise, weight gain, and nutrition. Once we cover everything, if you have any questions, please don't hesitate to let us know. We are always happy to answer questions and strongly encourage you to call us or consult your new OB packet with questions. There's a lot of misinformation on the internet and social media, so we encourage you to ask us. For typical pregnancies, recommended weight gain is going to be 25 to 35 pounds, but some patients will be encouraged to gain a little bit more or a little bit less. Just know that we will keep an eye on your weight gain and let you know if you're gaining too much or too little. Sometimes in the first trimester, women feel very nauseous and may eat more carbs or less food, so sometimes we will see a significant fluctuation in weight that will rebound or regulate as you get further along in pregnancy. We want to remind you that we strongly discourage the use of alcohol, marijuana, or smoking cigarettes in pregnancy. Our current research shows that there is no safe amount of these substances throughout pregnancy. A couple other common food questions that often come up are eating fish, deli meats, and soft cheeses in pregnancy. The most straightforward advice on fish is to avoid large fatty fish like tuna and swordfish, where harmful toxins and heavy metals can accumulate. For deli meats, I usually recommend, if it's freshly cut from your fridge, go ahead and just heat it in the microwave for a few seconds and then it's fine. However, if it's been sitting out at a luncheon for work, you're not sure, I would recommend avoiding it. Similarly, with soft cheeses, if it's pasteurized, it's sealed in your fridge, you love goat cheese, you're gonna die without it, it's fine to go ahead and eat it. However, on the flip side, if you're not going to be able to sleep for the next week because you're so stressed out about eating that soft cheese, just go ahead and avoid it. I do strongly recommend make sure you're rinsing your fruits and vegetables off with just water, especially those things like cantaloupes, watermelons, and avocados, before cutting through them to decrease any bacterial contamination risk. We're happy to talk through any specific questions you have related to foods to avoid in your pregnancy. Currently, for travel, you're okay to travel up to 36 weeks in the United States and international 32 weeks. But again, we do recommend avoiding countries that had Zika virus before COVID, as there are no great regulations and we don't know the true amount of Zika that is still present in those countries. Exercise is another big question that usually comes up. I definitely encourage patients to stay active in pregnancy, but there's a few things that you want to avoid. I usually recommend avoiding anything like Bikram yoga, those really hot yogas that can heat your core, or other activities like hot tubs or saunas, which we also recommend avoiding in pregnancy. For other exercises, I usually say that if you want to go for a run, great, but I wouldn't recommend a marathon. I think you could go for a hike, but I wouldn't recommend a 14er. But really listen to your body throughout, and if something doesn't feel good, just give yourself the ability to kind of back off.
Good afternoon. I am Katie Wagner. I'm a certified nurse midwife here at Partners Women's Health. Prior to joining the practice, I worked at a midwifery practice at Rose for 15 years. I joined Partners in January of 2021, in large part because at Partners we provide amazing care for women. The standard has always been to provide evidence-based care. That means here at Partners, we make recommendations based on current guidelines provided by ACOG, the American College of Obstetrics and Gynecology. For example, if we are recommending an induction, it is based on data demonstrating the safest outcomes for both mom and baby. There is a significant amount of misinformation about pregnancy and labor and delivery online. Navigating and differentiating between fact and fiction can be very challenging. We recommend discussing your questions with your providers so that we can make sure that you have accurate information.